Evacuation valves, we covered obviously what offices should do. And one of the other things I wanted to touch on, which is new for us, which I think fits perfectly right now, is this little Capt-all thing. And Capt-all is a handheld amalgam separator. And by July 2020, and some states are now pushing it back a little because of this current pandemic. They're allowing them to get an amalgam separator a little later rather than July. But if you're familiar with regular amalgam separators, which you've probably seen there, when the amalgam goes into your valve, it then goes into your line and then your chairside trap. There are studies, there's quite a few right now, that show 68 to 78% of the amalgam sits in that chairside trap. It never makes its way back to the amalgam separator. So you talk to any of your colleagues and they'll say, yeah, well, that's where it all sits. And then finally it drizzles down to the separator. And this little guy collects 95.4% immediately.
So Jim, would you use that just to remove the amalgam and then replace it with the other suction tip?
That's correct. So you would just change it right out when you're not removing amalgam. So it's a little more intelligent. You know, we know amalgam removals is drastically reducing. You know, you talk to someone who's doing 20 a month this year, they're doing 17 next year, and it just keeps going down. Most people aren't placing them, so that's helping with the reduction. But the EPA set a rule out there that says you have to collect, starting July, every dentist in the country and some specialists, and then you have to be able to recycle it. So this little guy gets taken, comes with a waste bucket that looks like this, comes with it. It gets recycled then. And
well, it makes it easy.
It does, and we're not using it unnecessarily. So you know, that's the biggest complaint with other systems is they fill up with all of the sludge, which is the blood, the saliva, the prophy, and then someone has to clean it. And by the time they get around to cleaning it, it's 6 months in. They have to wear a hazmat suit. And you know, you've read the OSHA rules. I mean, they got to wear a respirator. It's not just your N95. They got to wear a respirator to go back there. Utility gloves, mask, and goggles. This just makes it really easy. It's on that chair side. So we're looking at safer systems. That's really our goal here at Gov, is safer systems, more efficient systems, and then obviously we have both doctor and patient in mind with each system that we make.